develop our projects in different countries, in a different reality, different context, but we believe that the healthcare systems share common challenges in terms of equity, access, quality of services, efficiency, etc. We believe that it is necessary to analyze what is the relationship between health and sustainability. For us, sustainability is a large and complex concept, but sustainability are based in three fundamental pillars: economic, social, and environmental. For us, these three pillars are inseparables and interdependent. To analyze more accurately what is the relationship between health and sustainability is the most important objective of this seminar for us. Why the healthcare sector can explain and analyze this relationship with sustainability? Let me share only a few examples or only a few concepts. On one hand, healthcare sector or healthcare systems leaves an enormous carbon footprint. For example, hospitals consumes 3 times more energy in general than another regular office building. Hospitals generate an enormous quantity of waste and the toxic waste. The healthcare systems in general use the logistic chain supply intensively. This in one hand. And in other hand, we know that the environment is one of the most important determinants of the health at individual levels and at the community levels. All the changes in the environment systems have a direct impact in the health of the citizens.
Particularly if that healthcare reform piece works, where you can pay or play. If you give the individual consumer the money to buy healthcare, all of a sudden they're making choices as opposed to the employer. In conclusion here, really want to kind of wrap up here and talk about, my own sense of the bottom line of the sustainability. So there were really three concepts here that I think were spot on when Gesaworld did this. So the first one is economic development. I mean, clearly an enormous driver around why we need to consider health and sustainability. And I think, for me, it's all around two issues. One is the aging of the population, and the second one is the increasing prevalence of chronic conditions. Both of those together are what's going to drive the potential increase in healthcare costs, the potential consumption of the gross domestic product. So we have to pay attention that every country in the world is suffering from an obesity epidemic. The sad news is that we just, from a lifestyle perspective, we are not exercising, we are not paying attention to our diets, and that is not sustainable. So again, I think to some degree, this issue is at the center of global economic development. If you as a country are trying to compete in the world, you've got to get your arms around this. The only thing I'll say here is that it's sort of different for economies and established and developing economies. The social issues. I think again, well actually maybe I should get back to this one here, because again I was in China, was fortunate enough to be in China a couple of years ago, and one of the things that struck me about China is that there's this enormous national drive to be the #1 economy in the world. I mean, it's palpable when you go there. I mean, they were set to go. And what they did is they made the link between healthcare and economic development. So they said, if we're going to be the #1 economy in the world, and our workforce is what's going to make that happen, we need to make sure that we take care of our workforce, because to some degree they have an issue around replacements. With the one-child rule, their workforce population is aging. So they need to have that workforce working longer. So they need to have a healthcare system that will make that happen. So concurrent with their drive towards being the #1 economy, well, they are completely revamping their healthcare system. They're building thousands of hospitals, thousands of clinics. They're really thinking it through. So I think it's an example that supports the fact that healthcare and economic development are inextricably linked. Second issue here is social issues here. I think this issue around understanding consumer behavior, there's an enormous amount of work going on in America these days around why do people make the decisions that they do when they're in a healthcare situation? You know, a normal, rational person can be reduced to, you know, panic when a healthcare situation happens. I always tell people, you know, if you're a mother and you have a sick child, you're not going to worry about going on the internet to figure out the quality. You're going to get in your car and you're going to drive to the emergency room as fast as you can because your child, it's an emotional thing. But we're trying to learn about what is it that makes people make those decisions, because in many cases we make very bad choices. You know, do we need to go to the emergency room? Could we get on the phone and find out what's going wrong with my child? Could we try something first? But you know, so we need to understand how people behave in those situations, and how I behave is going to be different from you. It's going to be different from you. I mean, everybody has a unique way of responding, and the more we know about it, the better that will be. And I think to some degree, again, that linkage around consumer behavior, understanding consumer behavior, I think will help advance sustainability and the goals of sustainability. So again, it speaks to the power of the consumer. And then finally, environmental concerns. Health, safety, and environmental concerns are becoming part of the what I call the workforce ecosystem. I'll give you an example. There are a number of companies that I've worked with, multinational companies around the world, enormous footprints. Many of them have had for years a very, very strong safety culture. And they started to say, well, you know, people really are safety conscious, and I can measure it. I see the reduction in accidents. I see the reduction in those kinds of things. Why can't I translate that safety culture into a health culture? And surprisingly, it worked perfectly. So that these companies expanded the safety culture to a health culture. So for example, Chevron, every time you have a meeting with Chevron, they have two moments. Before they start everything, they say, we're going to have a safety moment and we're going to have a health moment. The safety moment is, if in many cases, if we have an emergency, here's the emergency exits. This is where you need to go. And the healthy moment is that we're going to have healthy food and we're going to stand up and do a little, move around a little bit. So again, they've linked the two. And I think that we could make sustainability and environmental issues link that together. So again, I think by linking the three together, you'll increase the awareness.